The coronavirus in Colorado.
Governor Polis just minutes away from holding a news conference at the State Department of Public Health in Glendale. Fox 31 is on it with live team coverage. We do begin with Fox 31's Matt Mara, who's at that press conference, and Matt, it should begin at any moment.
We are waiting for it to begin right now, waiting to hear from Governor Jared Polis. Health officials here with the CDPHE, the state health department, also the president and CEO of Centura Health, Peter Banco. This is what we know about this first confirmed case of coronavirus in Colorado. It is a man in his 30s who had recently been in Italy. He was an out-of-state visitor to Summit County. This man got sick up there, had an upper respiratory illness, which coronavirus is known to cause, was tested yesterday. It takes about 24 hours for these test results to come back. That test result here in Colorado came back positive today. Officially, it's CDPHE and the governor's office calling this presumptive until they send it off to the CDC. That's where the official confirmation comes in, and that goes ahead and puts it on the U.S. map, of which now at least 210 people in the U.S. have tested positive for the coronavirus. The New York Times reporting this afternoon at least 12 people have died because of it. Now, back here in Colorado, this man transferred from Summit County to the Denver metro area in isolation at a hospital and is recovering. Health officials are saying that the risk for that spreading to other people in the Summit County area is low. What we don't know and what we're waiting to find out here from the governor and health officials is, did this man stay at a hotel, potentially a ski resort? Obviously, a lot of people are going up to the Summit County area for that this time of year. Those are just some of the questions that we're looking forward to getting answered here coming up in just a few minutes. Erica, Aristea?
Yeah, Matt, we know you've been covering this a long time. A quick question for you. So 210 confirmed cases we know right now around the nation. This is one of the reasons we've been hearing CDPHE saying that they've been taking this seriously here for the last month and a half, even 2 months or so. Matt, if we can get you, I am wondering, they obviously knew this was coming. Do you think, obviously, this response was deserved?
Yes, as you mentioned, it was only inevitable. That's what pretty much every health official, public and private, had said about the coronavirus. Only a matter of time until it got here in Colorado. And it makes sense that it would come from an out-of-state, potentially an out-of-country visitor, someone who is in Italy, which is having a big outbreak. In fact, there are now travel restrictions from the U.S. going to Italy because of this. You talk about some of the testing that CDPHE has done here in Colorado. Up until this point, they have tested 58 patients for the coronavirus. 21 of those are still pending. The rest of them have all tested positive. Now, they have these new tests. The government's trying to get them out to state and local health officials as quickly as possible to get some of these tests done in 24 hours as opposed to the 3 to 4 days that it was taking a few months ago. Of course, federal officials came out today and said they're expecting more of those to come out. That's not happening as quickly as they had hoped. The governor, state health officials coming in here right now. We're waiting to get the very latest, find out more about this patient, more about where this patient has been, and potentially who this patient had contact with. Again, this is going to be Governor Jared Polis. He'll be walking in here in a second, along with many health officials. Obviously, you talk about the response from Colorado just by the sheer number of people coming in here to talk at a news conference. This is a very big deal. The state is taking it extremely seriously. It looks like some people are lining up right now, still waiting for the governor and a few more people to come in. Also, interestingly enough, today, the U.S. Senate passed an $8.3 billion spending plan to help fight coronavirus all across the country. This includes $3 billion to help develop a vaccine. We talked about this last night here on Fox 31, that this vaccine being fast-tracked, usually they take about 2 years to get developed. This one, if everything goes well, could be ready to go in just about a year. They're going to start testing that. They call it a phase 1 test on people coming up in the next couple of months. Also important to note that there are some companies, both here in the U.S. and in China, starting to test some antiviral medication on some of the patients who have confirmed coronavirus. If that testing goes well, they plan to be able to get government approval and expand that out to all the patients with it coming up sometime in less than a year. Erica, Aristea?
Yeah, Matt, it does appear that the press conference would start at any moment. But before we get started, can we just remind our viewers what are the symptoms that they should be looking for if they are concerned that they may have been in contact with an individual who has tested positive with the coronavirus?
Symptoms, and I believe these are correct. You can head to our website, ktvr.com, and get an official list. I'm sure health officials will talk about it here, but one of the big things is a fever, some body aches, also a dry cough. Those are some of the big symptoms. We're going to hear about them from health officials. Governor Jared Polis just walking in. We'll get the exact symptoms for you. You can always find more about that on our website. And here's Governor Jared Polis as we speak.
Information for Colorado Today. First of all, we have joining us here today at the Colorado Department of Public Health and Environment, Jill Ryan, the Executive Director, Dr. Rachel Hurley, the State Communicable Disease Epidemiologist, Scott Bookman, the Incident Commander for this incident of coronavirus, Mike Willis, the Director of Emergency Operations, Kevin Klein, who is the Director of Division of Homeland Security, Stan Hilke with Department of Public Safety, Summit County Manager Scott Vargo, Summit County Commissioner Elizabeth Lawrence, Peter Banco, the President and CEO of Centura Health, and Representative Julie McCluskey, who represents Summit County in the state legislature. This afternoon, I was notified that we have the first presumptive positive case of novel coronavirus, also known as COVID-19, in the state of Colorado. Because testing was conducted at the state level, the case is called presumptive positive. It's called positive when it's verified by CDC, but so far our state lab has run approximately 93 tests that have come back negative, and there are 38 tests that are pending in the lab. We expect that CDC is running on about a 48-hour timeline, but we have every reason to believe that, of course, our state lab, which has been tested, is doing these tests correctly, and this one came back as presumptive positive and is now being sent to CDC for official confirmation. Here's what we know. The subject is a male in his 30s who was visiting Summit County from another state. He traveled to Italy in mid-February, where there was an outbreak occurring. And also a travel companion of his is a known case of testing positive for coronavirus in another state. Upon returning from Italy, he spent time at home, then he traveled to Colorado on February 29th via plane. He was asymptomatic at the time. That means when he traveled at the airport, when he was on the airplane, he was asymptomatic, which means there is a low risk of transmission, non-contagious when you're asymptomatic generally, and that's according to the latest information from the CDC. Therefore, there's no reason at this time to believe that other travelers were exposed per current CDC guidance. We've also been in touch with DIA, and we have shared the information that we have at this time. The subject traveled from DIA to Summit County in a rental vehicle and met with friends where they stayed in a condo in Summit County. We know that he was there for outdoor recreation, and we're confirming those details. On March 3rd, he developed symptoms and went to St. Anthony's Summit Medical Center in Frisco, which is owned by Centura. On March 4th in the afternoon, a sample was taken. Today, March 5th, the test was conducted at the state lab, again, with the positive result, presumptive positive result. The patient was advised for his health to be transported to lower altitudes. The patient was feeling well enough to travel in a private vehicle with his fiancée to Jefferson County wearing a mask. At this time, he is now recovering in isolation in Jefferson County. His fiancée is in quarantine. His close contacts in Colorado, including the two friends that were Colorado residents that were with him on this trip, have also received quarantine instructions, and the quarantine orders are pending for those two additional individuals. Public health practitioners are investigating and will attempt to notify anyone else who may have been exposed because of this case when necessary. We will have Peter Banco is here from Centura Health to talk about that side where the exposure was limited to 4 personnel at St. Anthony's, all of whom took the appropriate precautions and all of whom will be tested. I also want to make an additional announcement that as we were preparing this announcement, we received word of a second presumptive positive case here in Colorado. We hope to have details on that later today. That recently came back from the lab, and we expect to have details. It appears to be a non-connected incident to this first incident. So that's all we have at this point, and we expect to have more information later this evening. As we informed the public earlier this week, we have been preparing for and expecting this situation for some time. We have an incredible team in place to keep Coloradans safe and to contain the spread of positive cases. By acting quickly, we can have a better outcome for Colorado. We've engaged the state's emergency response plan. We've opened the Emergency Operations Center, which is currently operating at level 2. And that means that we are going to expand testing so we can contain and isolate those who have become infected, anyone who is in the chain of contact with a known presumptive positive or positive case while they were in Colorado. And through our emergency response plan, we're coordinating with hospitals and universities to increase testing capacity. Current capacity at the state lab, 160 tests a day. That's with the regular shift. We can run another shift of people, and we believe even with the current resources, we can be somewhere between 200 and 300 tests a day if needed. And of course, we're working on vastly expanding that capability as well in the future, working with hospitals and universities. But we have the ability to at least do the testing for the people that are in the chain of contact in these situations. The more we can test, the quicker we can identify, the higher the likelihood of successful containment is. It's really that simple. Now, again, it's important to put this in the context. At least 80% of coronavirus patients recover after self-treatment and have mild to no symptoms. If they have symptoms, they can treat them with over-the-counter medications. But 20% of cases or so are more severe and might require additional treatment to avoid the risk of dehydration and for respiratory distress. We also know that older individuals and immunocompromised individuals are at a significantly higher risk level when it comes to most illnesses, and that would include coronavirus, and that would include the flu, and that would include many other illnesses. So again, a disproportionate number of the fatalities and the greatest danger to Coloradans is for immunocompromised and older Coloradans. There is currently no vaccine to prevent or to reduce the spread of COVID-19. But we do have some suggestions about how to protect yourself, and many of them are common sense, but that doesn't mean that they shouldn't be said over and over again, because it's important to hone up on what works to avoid contagion. Avoiding close contact with people who are sick, avoid touching your eyes, nose, and mouth, staying home from work when you're sick and keeping your kids home if they are sick, covering a cough or sneeze with a tissue and then throwing the tissue promptly in the trash, clean and disinfecting frequently touched objects and surfaces using a regular household cleaning spray or wipe. And very importantly, washing your hands regularly with soap and water for at least 20 seconds. Putting the soap on and really scrubbing your hands under water for 20 seconds after going to the bathroom, before eating, after blowing your nose, coughing or sneezing. And in addition, if you're using an alcohol-based hand sanitizer, make sure it's at least 60% alcohol content, and wash hands with soap and water. Coloradans get sick every day, and I don't want anybody to think that, to panic because of this. And if you have a fever, and if you have symptoms of a respiratory illness, such as a cough or difficulty breathing, so again, that's the symptoms we're talking about here. This is not a stomach virus. This is a respiratory virus. And if you've been in close contact with a person known to have coronavirus, or if you live in or have recently traveled to an area with ongoing community spread. And again, I encourage you to look at the CDC website in the internet for those details. In this case, it was Rome. We also have community spread in California and Washington State. If you can meet those conditions, then consult your healthcare providers. Healthcare providers, in turn, have been instructed to notify CDPHE and the CDC to determine if testing is needed, if it meets the standard and the protocol for that, and we move forward from there. At the end of the day, we have a very robust healthcare system in this state. We have a comprehensive plan in place. We've been preparing for this moment. We are now in execution mode of this plan. We have highly competent officials that are working to contain the spread, and I have full confidence in our state officials and health professionals to respond to this threat. We expect to continue to expand testing capacity, and even within the current context, we have the ability to test everybody who is in the chain of contact in this first case and in this expected second case presumptive positive that we will have more details on later this evening. With that, I'd like to turn it over to Jill Ryan from the Colorado Department of Public Health and Environment.
Good afternoon. First of all, I would like to thank the employees of the Colorado Department of Public Health and Environment. We have over 100 employees that have been deployed to this response and are working daily to keep the people of Colorado safe. The state strives to be as transparent as possible and provide the public with up-to-date and accurate information, and that's why we're bringing this information to you as quickly as possible. Our priority over the past couple of months has been to keep the people of our state safe. Our staff has been working around the clock, anticipating that we could see a case, but doing everything possible to ensure that if we did, we could limit and slow the spread. We continue to assess and test suspected cases, identify people who may have been exposed to cases, and determine the need for monitoring, isolation, quarantine, or other restriction of movement and activities. We are acting on all presumptive positive cases as if they were confirmed, because a quick response is essential to minimize the spread of the virus. Public Health is working closely with the CDC and local public health agencies across the state to ensure our response is proactive, strong, and collaborative. And we have wonderful partners in our local public health agencies that cover every county in Colorado. We have pandemic response plans ready to go. We have built tools and protocols to monitor travelers and other individuals who may be exposed. We have the infection control expertise we need. And perhaps most importantly, we've built strong relationships with our local public health and our healthcare partners. The sooner we know we have a positive case, regardless of severity of illness, the more effectively we can respond to, limit, and slow the spread. Colorado's taking an aggressive approach to testing, and we are testing cases that may be suspect and people that aren't yet hospitalized. This will help us detect the virus earlier. We'll continue this approach as long as we have the resources and capacity to do so. In addition, healthcare providers do not need pre-approval from public health for testing and specimen submission. So what people can expect is, because we're testing more frequently, we're going to start to see cases more frequently. With that, I want to turn this over to our state epidemiologist, Dr. Rachel Herlihy, and she can talk more about our control measures of the virus. Thank you.
Good afternoon, thank you. The risk to most Coloradans from this case is low. What we know from our contact investigation thus far is that the patient's travel did not put many others at risk. We are working with the appropriate local public health agencies to contact all people who are potentially exposed, to make sure they are quarantined and to test as appropriate. Remember, people would have to have direct, close contact with a person with COVID-19 to be at risk. That means a confined space for more than 10 minutes. We understand that people are very concerned about catching this illness, and we do expect to have more cases here in Colorado in time. Those simple, everyday actions like washing your hands, covering coughs and sneezes, and staying home when you're sick will make a difference in limiting and slowing the spread of this disease. Thank you.
Thank you. I want to introduce Peter Benko from Centura Health to talk about the success of the protocols at St. Anthony's and some of the things that are being done system-wide.
Thank you, Governor. So Centura Health has had a plan for a long time to prepare for such an incident. We've taken all the appropriate precautions. So we've got, for our communities, the appropriate personal protective equipment, pharmaceuticals, and other supplies needed to handle any cases that came to us. We opened our incident response for our Centura system earlier this week, and at each of our 17 hospitals to prepare for such an incident. Our incredible caregivers at St. Anthony Summit Medical Center followed CDC guidelines for care of the patient exactly, using personal protective equipment and putting the patient in a negative pressure isolation room. We coordinated care of the patient with the Summit County Health Department and CDPHE, and will continue to do so, as well as the governor's office. We notified all of our associates at St. Anthony Summit Medical Center as soon as we found out the presumptive positive. We were also notifying the 4 individuals that were impacted, and as well as all of our 21,000 caregivers across our system, so that we're prepared for the next case that comes to one of our clinics, ambulatory centers, or hospitals. With respect to the 4 individuals that we're caring for the patient, we will be following CDC guidelines, as well as giving them the free testing that's available by the state. Thank you.
Thank you. We'd be happy to answer any questions. Yes.
Are you on a trajectory, do you foresee a trajectory to a state of emergency like other states have deployed today, or what does that look like if you do pull that trigger?
Again, this is the first incident in Colorado with a presumptive positive. We have a second presumptive positive. If the emergency powers are needed to keep the people of Colorado safe, I won't hesitate to invoke that authority, but it's not being invoked at this point.
Where is the second presumptive positive? Is this the teacher that was in the Boulder Valley School District?
No, again, details are pending on that. They'll be available this evening. At this point, there's no known connection to the first case, so unless additional details come out, it will be treated as a second case, and that information will be, more information will be made available this evening.
How many tests do you have here in Colorado? I know the federal government came out today and said they didn't have that million number that they were trying to hit, and are you concerned at all that you may not have enough?
So Congress has, the House passed yesterday, I believe the Senate passed today, a supplemental of about $8 billion. Included in that are a couple things. One is increasing testing capacity nationally. Secondly, will be approximately $9 million for public health in Colorado. That's our estimate of what would be received. Again, when you're talking about resources, when you're talking about emergency authority, it all depends how much this grows. Now, again, our hope is that by acting quickly, by acting boldly, in this case, in the second case, and any other cases in the next week or two, we hope that we don't need additional resources. We hope that we don't need to invoke emergency authority. Again, depending on what happens, we stand by and we're ready to do that. But at this point, our hope is to act quickly enough to avoid that.
Yeah, this first presumed positive case, did this individual expose people at our ski areas or in businesses in Summit County?
There are, again, 2 people that are Colorado residents that traveled with him and recreated with him, his fiance as well. They are under quarantine. Right now, they have pending quarantine orders on those individuals. And as part of the interview and health evaluation process, we're learning if there's anybody else that he came in contact with that needs to be placed under quarantine.
Can you clarify that he was here to ski or board up in Summit County? That's what he was doing, the outdoor rec?
We don't have the information on what kinds of outdoor recreation he was engaged with, but he was here for outdoor recreation in Colorado as a tourist.
Had he engaged in any of that before he got ill?
When he arrived here, he was healthy, and again, he recreated with his friends who are now under a quarantine order.
What about that condo up in Summit County where they were staying? Is there an effort to do anything, contaminate that, clean that, let the next people know?
You know, again, what Summit County, we can turn it over to Summit County Public Health, but they are looking at anybody he might have come into contact with and make sure that those people are given the appropriate warnings. Does anything else from Summit County? Yeah, that's good.
The only comment I would make on Summit County's behalf is that we're working very closely with the state CDPHE on the investigation and all the efforts, and we've been working with them leading up to this as well. Summit County has pandemic planning in place as well. We've opened our EOC, and we will continue to work with the state to identify any other concerning areas.
We just can't say for certain that there's like an effort at that condo necessarily.
Not at this point, I can't say that.
Can you identify yourself, please?
Summit County Manager Scott Vargo.
How's his health now? I mean,
I'm in touch with him. I look forward to having a conversation with him tomorrow. He, I think, was, taking this information in stride. He was just given the diagnosis this afternoon, and I'll be connecting with him tomorrow. The period of the isolation will likely be, 14 to 21 days at least. And so, you know, it's important that he maintain that. It is an isolation order, and we're going to try to make him as comfortable as we can for staying in Colorado. He requires no additional medical treatment at this point.
The status of his fiancée?
She is under quarantine with an order pending for quarantine. So isolation is somebody who actively has the symptoms. Quarantine is somebody who's been exposed. And she either, as of this moment, either has or it is pending moving from voluntary quarantine to an ordered quarantine.
Where in Jefferson County are they being quarantined?
That's all the information we have. They are in isolation and quarantine in two different, they're not in the same place, obviously. One is
Can you say if they're like a medical facility?
What airline he was on?
I don't have that information, but you know, some of that will be made available to make sure that people who might have come into contact can have that, can make sure that they know that they were put at risk.
Are those on the plane at risk?
According to the CDC guidelines, the answer is no, meaning he was asymptomatic, therefore they're not at risk.
Just to be clear, was it DIA?
Yes. DIA, rental car to Summit County is how he got there.
Can you clarify how many? You said 4 people in quarantine?
There are. So again, 1 under isolation. That's the patient.
Yeah, okay.
3 under quarantine. 2 friends who are Colorado residents, and his fiance who traveled with him.
Okay. And the healthcare workers, that's not a quarantine. That's
No, they took the adequate precautions, and they will be tested, but they took the precautions, and at this point there is no quarantine recommended for them yet.
And is the thinking he may have picked this up in Rome?
Again, what we have on information is that one of his associates, let me see what the word we have here is, a travel companion of his to Italy is a known positive case of COVID-19. So he traveled with somebody who was later diagnosed with COVID-19.
Did he go to Italy?
Yes.
Okay.
He traveled to Italy with a travel companion. His travel companion had earlier been diagnosed with COVID-19, and now he is presumptive positive for COVID-19.
For Mr. Benko, we've heard reports that the hospital or the health center in Summit County is on lockdown. Is that correct? Or are they doing anything special there?
No, that's not true. We're available to care for everybody. We've notified all of our associates this afternoon, including the 4 that are there. There were only 4 people that were exposed, and we're taking following the CDC guidelines and making sure they're getting tested. So no, we're open and available for business.
Did the patient walk in and say he had these symptoms, or did he call ahead of time to let you know?
We knew, I can't get into the details, but we knew the patient had concerns about his illness ahead of time, so we were able to take the appropriate precautions when he arrived to the hospital.
If other people think that they may be sick, should they call or do something ahead of time as opposed to walk into an ER and urgent care and potentially put more people at risk?
All of our staff were prepared, so if someone presents with the CDC guidelines around preparation, all of our staff know what to do and are fully prepared to take care of somebody. So whether you call or not, we're prepared.
Can you clarify again, the way that this might change the testing criteria? We already know what it has been, and then this, if they come in contact, I guess walk through that again.
Of course, we'll continue to honor the CDC testing criteria. In addition, we will aggressively use testing for anybody in the chain of contact with this first case, as well as the second case.
And I guess that kind of develops as you figure out who
again, these are based on interviews with the patients, who they might have come into contact with. We feel that we have the sufficient ability for at least these 2 cases and perhaps even a few more to aggressively test everybody in that chain of contact.
You said at the beginning of this that you had great confidence in the state test. Is there any sort of percentage of accuracy? I know this is kind of a new thing. What can we say about that test?
No, again, we call it presumptive positive. That's just what the terminology is. For all intents and purposes, it is positive. It needs to be confirmed by CDC to be officially called positive. We have, at this point, 93 negative tests, 38 pending tests, and 2 positive tests that have been done in Colorado.
Overall, should people here in Colorado change their behavior at all? Or would you say go about their daily lives? Should they be concerned about being in big crowds or confined areas?
Well, I don't plan on changing mine. That's a personal decision. I think, again, take precautions. If you are ill, don't go to work. If you see somebody coughing or sneezing, it's usually not a good idea to go right up to them anyway. You don't want the flu, you don't want a cold, you don't want coronavirus. At this case, at this point in time, Again, there are greater health threats in Colorado, but watching what has happened in other places, we want to make sure that we, to the extent we can, nip this into the bud to prevent this from breaking out in Colorado in a greater way.
We'll take 2 more questions.
What's the timeline on the CDC confirmation? How long does that take?
48 hours.
48. And
Within 48 hours,
do you know
we're
what
hoping
specific,
24.
Resort this person was staying at in the mountains?
Do we have that information?
No, we're still working on
Yeah.
confirming that. Last question.
Do you plan to order that insurers waive their fees for testing and treatment?
So we have seen what some other states have done. At this point, the free test that Colorado is doing is covering the demand. We hope to increase those. If those are going to be run by other providers, we would look at using our authority to make sure that there was no penalty or charge to patients.
I have a question for Summit County. I understand that there's also an issue of concern about a possible mumps outbreak there. Are any additional staff or resources going to be sent to Summit County to deal with this issue?
So there is an ongoing mumps outbreak within Summit County, within the Keystone area of Summit County, that has strained some of our local public health resources. Part of that is why we're working so closely with the state and the CDPHE to be able to bolster the amount of staff that we have, and the state has been very forthcoming with resources, and we expect to leverage those as needed.
Do you know what car company he rented that from and if that car has been disinfected?
We don't have that information. Again.
Yeah, you just heard from Governor Jared Polis there, along with several other health officials, speaking to this very quick response in order to contain the spread and also to minimize fear here of these 2 presumptive positive cases of the coronavirus. He said to us, presumptive positive for all intensive purposes. We should just assume these to be positive cases once that is confirmed nationally. Now, here's what we know about the first case. We know a man traveling out of state in his 30s visited Summit County. We know that he had known exposure to someone who did test positive for coronavirus. It was a man who spent time in Italy in mid-February. That man flew to Denver International Airport, where he rented a car. He traveled to a condo. Again, they said while he was traveling, he had no known symptoms at the time. They said that does minimize the threat level and the fear for those that were at Denver International. When they say when you don't present symptoms, it does mean that you're likely not as contagious, if contagious at all. On March 3rd, he started to develop symptoms. That's when he went to St. Anthony Hospital in Frisco. He was then taken to the hospital in Jeffco once that test result came back presumptive positive. They brought him down to lower elevation because they thought this would aid in his recovery. That patient now in isolation. They did not say exactly where this patient's receiving treatment. We also know he had 2 companions with him at the time. Those companions are in quarantine, very different from isolation. Isolation is where you go when you test positive. We know that quarantine is where you go when you're at risk of testing positive.
That's right, and his fiance as well, also in quarantine. And we also know that they wanted to make a point that they are testing very aggressively, going beyond the CDC guidelines at this point. And so it's not going to be unusual if we start to hear, start to hear more frequent cases potentially of the coronavirus, as well as they wanted to make a point that if you were in a confined space for more than 10 minutes, that is when you are more at risk if there was a person who had tested positive for the coronavirus. Is something that they want to keep in mind there as well. And right now we do want to send it out to Michael Konopasek. He has more on the testing when it comes to the coronavirus here in Colorado.
Yeah, right now, 20 people at the state laboratory are specifically testing for the coronavirus that causes the COVID-19 disease. State health officials, they say, quote, all hands are on deck. Step 1 requires protective gear as a lab tech handles infectious material with the potential of containing the novel coronavirus.
Pull out the viral nucleic acid out of any samples.
RNA is extracted, sending the sample to stage 2, where it stands up with reaction targets, positive and negative controls of the virus. Emily Travanti is the scientific director here at the State Public Health Laboratory. Her team has been busy since early this year.
We're seeing a surge in test requests.
And the COVID-19 work is being done while demand remains for other tests.
We test for a lot of different pathogens every day. The staff are highly trained. This is what we do every day here.
The state is using the CDC emergency use authorization test for a virus that is still a mystery to health officials around the world. Samples are collected from the nose and throat. But after those samples are secured, much of what happens next is unknown to the general public, a reason why state officials invited the media here to show off their work.
I think it's really important for the public to see what's happening behind the scenes here at the laboratory, to understand that we have the staff ready, that we're processing the samples through the door as they come in.
So there you go, a behind-the-scenes look. Now, from that laboratory, what happens next? The reporting. And the state reports on Monday, Wednesdays, and Fridays routinely since earlier in the year. So more results to come out tomorrow, as you heard from the governor much earlier there. And we have a link on our website to all of that information. You can find that at kdvr.com. We are live in Denver. I'm Michael Konopasek, Fox 31.
All right, Michael, thank you. Well, school districts around Colorado doing their part to keep classrooms safe from any potential coronavirus outbreak. Fox 31's Kevin Torres on that angle for us this evening. Joining us live from downtown Denver. He's been talking with districts about their plans. All parents obviously want to hear this information. Kevin.
Absolutely, RSA, and you know, the breaking news this evening is exactly what school districts across the state have been preparing for. Denver Public Schools is going about things how they have been, telling people to wash their hands, not touch their face, but they also have these unique tools.
We just keep making sure that school's safe for our kids.
At John F. Kennedy High School in southwest Denver, facilities manager Tony Ravelis has his hands full.
Oh, yeah.
He's using a cordless electrostatic handheld sprayer, which is full of disinfectant.
Basically, you spray the whole doorknob, and it covers everything.
DPS has 6 of them, which it rotates between its 200-plus schools on an as-needed basis. They help cover large areas faster by speeding up the process by about 60%, the school says.
The cleaning agent that they use really does a very good job of destroying the bacteria.
The chemical they use is approved by the CDC to help combat viruses such as the flu, the norovirus, and can even help with the coronavirus.
Expert, it kills all the germs. It kills everything. And it has a 1-minute time for killing all the germs.
DPS has an infectious disease process it goes through when administrators notice an uptick in the number of students calling out sick. If fewer than 10% of the school's student body calls out sick, DPS only disinfects classrooms. Once that number hits 10%, the district will disinfect the entire building. At 35% or above, administrators would call in outside help from contracted vendors. Fortunately, they haven't had to use them for any potential coronavirus threats.
Nothing yet. So we're good. We're just trying to be proactive.
DPS's message to parents right now, a simple one.
If your kids are sick, keep them home. Don't send them to school.
Good advice. In case you're wondering how much one of those green disinfectant spray guns would cost, I looked it up, about $1,000 a piece. Now, school districts across the state, as well as DPS, are working with state health officials to follow their guidelines and make sure everyone is safe. Live in downtown Denver, I'm Kevin Torres, Fox 31.